If you or the patients you support live with chronic respiratory disease, you already know this truth. Breathlessness doesn't just hit the lungs, it hits the mind. Anxiety, panic, avoidance, exhaustion, they sneak in the moment when the air feels thin. In this video, I'm going to show you a simple framework that makes those moments far manageable. The GROW model. Whether you're a patient seeking more control or a healthcare professional trying to support your overwhelmed patient, this video is your map. Here's the issue most people miss. Chronic respiratory disease symptoms and mental health feed off each other. Breathlessness sparks fear, and fear tightens breathing. And suddenly, the day is small, the world feels risky, and confidence evaporates. Many patients say, I'm scared of my own breathing. And many clinicians say, I can see the distress, but I don't have time or training to address it. This is exactly where the GROW model becomes a lifeline. Let me tell you a story about two people who keep crossing paths, a patient who fears their own breath and a clinician who wants to help but feels like the clock is always against him. And their story belongs to millions. Maya is 52 years old. She lives with chronic respiratory disease. Her lungs have voices of their own. And some days they whisper panic before she's even out of bed. One afternoon, as she climbs two steps to a doorway, breathlessness hits. Not just the physical sensation, the fear. A mind raises. What if it gets worse? What if I can't control it? The fear tightens the chest more than the disease itself. Maya avoids rants, avoids outings, avoids anything that might make her breath too hard. She describes it as living in a shrinking room. Now let's walk through the GROW model together with Maya, direct and simple. In GROW, G stands for go. So Maya, you need to ask yourself, what do I actually want to feel or achieve? Most patients name goals like less anxiety during breathlessness, more confidence with self management skills like inhalers, pacing, or relaxation, better quality of life, and emotional resilience. Think this as setting the destination very clear, human, and achievable. Next, R in the GROW model. R stands for reality. Now, what's happening right now? Maya needs to think. Now, Maya, check this out. Are anxiety, low mood, or fear showing up often? Do breathlessness episode triggers panic? Are you avoiding activities or isolating yourself? Is sticking to treatment routines hard? Unsure how to use inhaler correctly? And who supports you regularly? These checkboxes isn't about judgment. It's a clear-eyed snapshot of your current living situation with your chronic respiratory disease. Now let's move on to O in the GROW model. O stands for option. You always have choices. Helpful ones include pulmonary rehab with psychological support, breathing control practices tailored to your cultural practices and your beliefs. For example, westernized thoughts are more aligned to personal breathing, diaphragmatic techniques, and Eastern thoughts are more aligned to pranayama techniques like Nadi Shodhana or Brahmari or Kapalpati. So, tailor the breathing control practices to your beliefs and needs. And cognitive tools can help to interrupt your catastrophic thinking. And you can choose peer support groups or online communities. And check out your daily routines that support phasing and sleep. You don't need all of them, just the ones that fit your life. Now let's move on to the next letter, W, in the GROW model. W stands for way forward. Now choose one or two steps you'll start with. Create a weekly plan that mixes physical and mental health strategies. Schedule a follow up session with your clinician or therapist as needed. Use mood or symptom tracking apps. Set early warning signs for anxiety and decide what actions you'll take when they show up. This is where change actually begins. Now let's flip this lens. Maya isn't the only one who's struggling. Sam, the respiratory nurse, carries his own weight. His clinic run back to back, and patients come in exhausted, frightened, and overwhelmed. And he often feels untrained for the emotional avalanche that comes with the chronic respiratory disease. He tells his colleague, I can spot wheezing in 10 seconds, but depression, anxiety, that's harder. The GROW model helps him too. Year G, the goal, Year Sam's goal might be feeling more confident addressing psychological distress. improving communication and motivational interviewing skills. Not perfection, just comfort and clarity. So you can set something like, I want to feel more confident supporting patients emotionally. And next are the reality. Reality is 10 minutes for appointment, no formal mental health training, difficulty separating breathlessness distress from depression, emotional fatigue from years on the front line. He isn't failing, he is human. Naming these pressures makes space for better solution. And next to letter O, options. You're not alone. Here are realistic supports. Short workshops on tools like Patient Health Question 09 and Generalized Anxiety Disorder 7, and integrating psychologists into multidisciplinary teams. Monthly reflective practices with colleagues. Using micro interventions like short validating conversations during routine visits. None of these require reinventing the clinic day. It takes less than 20 minutes, small investment with large returns. And now moving on to the final letter W in the GROW model way forward. Sam need to choose the next steps he can actually implement, like a simple mental health screening pathway, monthly multidisciplinary meetings that include psychology, brief psychological intervention during routine visits. These conversations often take under 2 minutes and shift the entire tone of the care. If you live with chronic respiratory disease or if you care for people who do, the GROW model brings structure to fear, clarity to confusion, and possibility to days that feel small. And if you want deeper guidance, we offer a teletherapy training program designed for both the healthcare professional and to the patient to build the champions inside them. For patients, we have Breathe Better program. For the clinicians, we have respiratory psychology and cultural competence in care for chronic respiratory disease and mental health condition. These two courses for the healthcare professional strengthen the connection, trust, and effective care across diverse communities. You deserve support that meets you where you are, the lungs, mind, culture, and all. If the story helped, hit the like button, subscribe, and share your experience in the comments box below. Your story might be the one someone else needs to breathe a little easier. And remember, every breath is a step towards calmer breathing and steadier mind. As usual, until my next video, stay curious, stay healthy. Signing off, Devi Sundar.